Neuromuscular deficits and ACL injury risk in post-pubescent adolescent females. Each day, human bodies perform a number of landing tasks associated with daily living, such as walking down a flight of stairs or stepping out of vehicles. In athletics, landings are most often associated with descending from a jump, such as in a jump shot in basketball or jumping to spike a volleyball. Landings are considered by many to be very high-risk activities associated with various acute and chronic injuries, and while many individuals are able to avoid such injury in a planned landing, injury risk increases in an uncontrolled environment. It is widely accepted that female athletes are at an increased risk for ACL injury compared to their male counterparts. While several contributing factors have been identified, such as anatomical, hormonal, and neuromuscular, not all of these factors are modifiable and lend themselves to alteration for improved performance and decreased risk of injury. Even so, biomechanical and neuromuscular risk factors may be critical components of the mechanisms which underlie the higher rate of ACL injuries in female compared to male athletes. 4 neuromuscular control deficits have been identified, including ligament dominance, quadriceps dominance, leg dominance, and trunk dominance or core dysfunction. An athlete with a ligament dominance has an imbalance between the neuromuscular and ligamentous control of dynamic knee joint stability. The second, a modifiable neuromuscular control deficit termed quadriceps dominance, can be defined as an imbalance between knee extensor and flexor strength, recruitment, and coordination. The third, referred to as leg dominance, is defined as an imbalance between the two lower extremities in strength, coordination, and control. Lastly, the fourth neuromuscular control deficit, termed trunk dominance or core dysfunction, is defined as an imbalance between the inertial demands of the trunk and control and coordination to resist it. Identifying modifiable risk factors is of great importance in order to reduce ACL injury risk in female athletes. As mentioned above, one modifiable neuromuscular risk factor is quadriceps dominance. While descending from a jump, both quadriceps and hamstring musculature, as well as other muscle groups, are activated in order to stiffen the knee joint and provide protection upon landing. A reduction in the recruitment in one or both of these muscle groups can cause the joint to collapse, increasing the risk of injury. Furthermore, the hamstrings act as an ACL synergist, in which serves to prevent anterior translation of the tibia and thus preventing an ACL tear. A quadriceps dominance predisposes an athlete to an ACL injury. Increased activation of the quadriceps and decreased activation of the hamstrings alters landing mechanics. For instance, an athlete may land with more anterior movement of the knee, hips, and trunk. These landing mechanics increase the strain placed on the ACL in an attempt to thwart anterior translation of the tibia. The lower hamstrings activation, the less assistance they provide in preventing anterior movement of the tibia. While many researchers have shown that females tend to have much greater quadriceps to hamstring strength ratios, these studies primarily included adult females. Pertaining to the younger female population group, post-pubescent adolescent females, the majority of research available regarding dynamic joint stabilization utilize ground reaction force plates and three-dimensional motion capture systems and did not include electromyography assessments. Electromyography, or EMG, is a diagnostic instrument for assessing muscle activation via electrical signals that cause muscle to contract. While EMG has a reputation of being messy, it is the best instrument for assessing muscle activation, as is needed in order to assist in understanding the way neuromuscular control factors may manifest in terms of ACL injury is crucial, as it offers the greatest potential for interventional development and application in high-risk populations such as athletes. While measures of ground reaction forces and joint torques provide immeasurable insights in biomechanical assessments of lower extremity kinematics and force attenuation, it seems necessary to include measures of EMG of relevant musculature aiding in dynamic joint stabilization. Currently, there is a lack of evidence available pronouncing the muscle activation patterns of the quadriceps and hamstrings in post-pubescent adolescent females. Moreover, there have only been a handful of research studies that examine the effects of plyometric training intervention on patterns of muscle activation and reducing ACL injury risk in adolescent female population, and these studies did not include measures of EMG. EMG assessment could provide valuable information with regards to neuromuscular deficits, specifically abnormal or asymmetrical muscle activation patterns that may be placing adolescent females at an increased risk for ACL injury. Furthermore, knowledge of these deficits assists greatly in the prescription of neuromuscular training programs in an effort to reduce the risk of ACL injury.